Well, I hope you're having a wonderful Saturday, and welcome to WFME Reports. I'm your host, Jay Trelease. My guest today is Dr. Adam Schaffner. Dr. Schaffner is a fellowship-trained Manhattan plastic surgeon. He's extremely passionate about what he does, and he's here today to spread the word. If you're going to get plastic surgery, do your homework. Dr. Schaffner, thank you so much for being here at WFME Reports.
Thank you for having me.
Now, plastic surgery, I mean, you're growing up as a young man. You have designs on being a doctor. How did it roll into plastic surgery? How did you get into that field?
I always wanted to make a significant difference in the lives of patients. And in plastic surgery, you have the opportunity, and in my opinion, the privilege of working with patients to make a significant difference in a very short period of time by helping them look better and feel better about themselves.
I think one of the misnomers about plastic surgery, and I think I fell into it as well, is that it has a lot to do about vanity. But that is often not the case, right?
That's absolutely correct. So you have situations where patients are having plastic surgery not only for aesthetic or cosmetic purposes, but also for reconstructive purposes. Sometimes it's for masses that they have that are causing problems that need to be removed in the areas that need to be reconstructed. And in those situations, it's not a cosmetic case, it is a reconstructive and functional case.
Now, Dr. Schaffner, I know that you're here today because you're passionate about this subject, and you're charged up about the fact that what you do, what you specialize in, what you are trained in, and what you do so well is being misrepresented out there by others. And there's a lot of people, needless to say, there are people who are actually dying because they're getting the wrong kind of treatment. Am I correct?
You are absolutely correct. So there have been a number of reports in the media which have reported on botched aesthetic plastic surgical procedures, many of which were performed by doctors who are not plastic surgeons. Some of the people who have performed these procedures aren't doctors at all. And many times they are getting patients based on their advertising and based on low price. And I think what your listeners need to know is that they need to do their homework. If they want an aesthetic or cosmetic plastic surgical procedure, they need to make sure that the doctor that they see is in fact a doctor and is a properly trained and credentialed plastic surgeon.
And how do they discern that? What tools could you give our listeners so that they can be more discerning in that regard?
Well, initially, even when they just first call the office, they need to ask, is the doctor a plastic surgeon? And if so, they need to ask, is the doctor a board-certified plastic surgeon? There are many doctors who are practicing who will say, oh, I'm a cosmetic surgeon. I'm an aesthetic surgeon. Or, yes, I'm board certified, but they don't tell you in what specialty they are board certified. And you want to make sure that they are a plastic surgeon and that they're board certified in plastic surgery.
Now, you cited a couple of, I thought, compelling examples when we were talking earlier off air about two professional people who really got into a lot of trouble by not doing their homework. Can you tell us those stories?
Absolutely. So I have a patient who is a physician, an MD, who went to another physician to have a type of procedure called a thread lift, where instead of making an incision that would usually be performed for a facelift, put little threads with barbs on them underneath the skin to try to lift the cheeks and the jowls and the neck in the hopes of rejuvenating hair appearance. And the unfortunate complications which resulted were very unpleasant for her, and she ended up being referred to me to try to fix those complications which occurred. Thankfully, I was able to do so, and she later learned what the difference was between her doctor, who was an eye doctor, and me, who was a plastic surgeon.
I mean, there are so many ironies in this particular tale. I have to really one at a time. You're saying that this woman who got into trouble, who came to you after she got into trouble to sort of have you fix what was done previously to her, was a doctor herself. She was an MD.
Yes, that's correct. She was an MD.
I mean, you would think that a MD would have the savvy, the gravitas to make the right decision? What was she thinking, and how did this happen?
Well, I asked her that exact question because I would think as a physician that all physicians would understand the differences and subtleties between the various specialties. The fact of the matter is that physicians are, when they are patients, like any other patient. And unless they are experts in that particular field, they're not going to necessarily know the difference any more than any other patient. And so it is that and other examples like that of other healthcare professionals that I've treated that has really inspired me to try to educate people amongst the entire population, including the healthcare professional population, about what the difference is between a plastic surgeon and a non-plastic surgeon who is performing cosmetic or aesthetic surgical procedures and non-surgical procedures, and why it's important to make sure that the doctor that they see for those procedures is properly trained and credentialed.
Well, you also said that the doctor that this woman saw was an eye doctor. Did I hear that correctly?
You are correct. He's a board-certified ophthalmologist and went on to perform an ophthalmic plastic and reconstructive surgery fellowship. But just because somebody can perform beautiful eyelid surgery doesn't necessarily mean that they should be doing other procedures outside of their area of expertise.
Is there a place for lay people like myself, a common person who may find themselves at some point in their life, they need to get reconstructive surgery, they need to see a plastic surgeon, and there are many reasons that someone goes to see a plastic surgeon. Where do we go? Where do we turn? Is there a place on the internet we can look at? And I mean, do you have any suggestions?
Absolutely. Well, first they can speak with their physician. Normally, a physician will have a good idea of who is able to properly perform those types of procedures in their community. In addition to that, on the web, they can go to websites such as www.plasticsurgery.org, which is a website for the American Society of Plastic Surgeons. And if they want to speak with someone like myself personally, they can go to www.drschaffner, that's DRSCHAFFNER.com, or they can call my office at 212-688-6600, and I'd be more than happy to personally answer any questions to help them.
Doctor, when did you decide that you needed to get the word out, that you needed to come to the media, that you needed to do programs like this and educate people? Obviously, this was this was something that you didn't set about doing when you initially became a plastic surgeon, right?
No, certainly not. So the patient that you referred to, I actually treated in 2006, and the number of patients that I have seen since that time to correct problems performed by other doctors has only grown.
Really?
And it is that increase in the number of problem cases that has inspired me to promote the difference between a plastic and a non-plastic surgeon. And it's not just me who's discussing this. This is being discussed on national, state, and local levels. It's being taken up by legislatures. It's being discussed in the media. And it is a very, very important topic that the press has actually covered quite a bit in detail in recent articles that are in the lay press, on television, in newspapers and magazines.
What would compel an eye doctor or a doctor who specialized in something other than plastic surgery to do that kind of work? Why are they doing that?
Well, ultimately, I think you'd have to ask them. If you're asking my opinion of why they're doing it, I think that it comes down to the desire for them to build a cosmetic or aesthetic practice, and much of that is due to the fact that the specialty in which they were trained is not providing an income level that is allowing them to support their practice as they were previously, because it's no secret insurance companies are cutting reimbursements, and while they may charge X number of dollars, they get paid a mere percentage of that as someone looks at their explanation of benefits form that they get from their insurance carrier. And I get that all the time from patients who will say, wow, the doctor charged $500, but the insurance company paid them $86 for a 30-minute checkup with their internist, how can they afford to pay for their rent? And I said, it's a very good question. And unfortunately, I don't think that this is a trend that we're going to see changing. If anything, I think it's just going to continue to get worse as time proceeds.
Mm-hmm. So really there are financial reasons that some physicians might branch out into this kind of work.
Absolutely.
Can I go into any doctor's office and get a Botox injection? And this isn't for me, by the way. I'm asking for a friend.
No. Of course. You look great. The fact is that any licensed physician can purchase Botox from the company that manufactures Botox. And whether or not that doctor is an internist, a pediatrician, an obstetrician, they can get Botox and they can inject it. In fact, they don't necessarily even need to be an MD. They could be a dentist and go ahead and inject Botox.
I mean, you can be a dentist and inject Botox. What mechanism isn't working or firing off here that we can protect people? What's not happening here? That it seems to be some kind of miscommunication, or perhaps the technology and the advancement in this kind of procedure has gone beyond how we can legislate it or pull it back or control it. Am I right in assuming that?
Well, Botox is an injectable medication, and it's an injectable medication which is approved by the U.S. Food and Drug Administration, and the FDA restricts the sale of that medication to any licensed physician. And as long as a physician is licensed in the state in which he or she practices, that individual can purchase Botox just as they can any other FDA-approved medication.
We are talking to Dr. Adam Schaffner, who is a fellowship-trained Manhattan plastic surgeon. He's here today because he wants to get the word out if you're going to participate in plastic surgery. And let's face it, a lot of plastic surgery comes about not because of vanity issues. And if that's your issue, that's fine. I mean, that's neither here nor there. But a lot of times people need plastic surgery, often for cancer diagnosis or various other diagnoses. And we find ourselves many times dealing with plastic surgeons, and we really don't have a clue as to what to look for, what to discern. And Dr. Schaffner, I think, is fed up. I think you are fed up, aren't you? I mean, this is why you really want to get the word out.
I'm very concerned for patients who are out there, because I see more and more patients in my practice who have seen doctors who are doing procedures in which they are not the most experts, in which they are not the most well-trained. And in my opinion, much of it is financially motivated. And so if the state and federal laws are not going to protect patients to prevent these kind of problems, I think it's incumbent upon patients to educate themselves so that they protect themselves and their families from being treated by healthcare professionals who may not be the most expert in performing the procedures that they're offering.
Dr. Schaffner, can you give us some red lights if we're looking for a plastic surgeon? Are there certain things that we should look out for that should give us definite pause before we proceed?
Absolutely. I think the first question you need to ask the doctor is, are they a plastic surgeon? And if so, what board are they certified by? Is it the American Board of Plastic Surgery or the American Board of Facial Plastic and Reconstructive Surgery? If it's for a facial plastic surgical procedure, the answer should be yes, at least to one of those two. If the doctor says, oh, yes, I'm board certified. Well, in what field are you certified? Oh, cosmetic surgery. Well, if you go on to that website, you'll see that there are many doctors there who are obstetricians and gynecologists, internists, dentists, and other specialties which have nothing to do with plastic surgery. And they have met a set of requirements that were established by an organization which is not part of the American Board of Medical Specialties. And that is the overarching body that recognizes and accredits the 24-member boards to allow them to label a doctor as board certified in a specialty. And so anyone can form an organization with the American Board of such and such and then become board certified by that board, have a beautiful website for that board, and have a fancy certificate or diploma that they can frame beautifully and put in an office. But that doesn't necessarily mean that they've gone through a rigorous 6 or more year training process after medical school to have the knowledge, training, and skill to be able to properly perform plastic surgery, and to do so in an accredited facility, and to make sure that the doctor has hospital privileges for the procedure which they're performing.
One of the things that strikes me and has struck me over the years in regards to this subject is, I don't know any other way to say it, the death toll. I think of going back a few years, the great late James Brown, his wife underwent cosmetic surgery or some sort of surgery that had to do with making her feel better about herself or whatnot, and the poor woman died. And that's just one example. It happens more often than it should, doesn't it?
It does, and people have died, people have lost their eyesight, and I want to be clear, complications can happen even in the best of hands, in the best of facilities. But like with anything in life, we try to go ahead and minimize the risk of such complications occurring. And in my opinion, one would be best served to seek out a properly credentialed plastic surgeon who operates in an accredited facility and has hospital privileges for the procedure which they're performing, to minimize the risk of any complications from occurring, and should such complications occur, to maximize the likelihood of a successful outcome.
It seems to me that more and more women, and I may get in trouble saying this, are interested in getting plastic surgery. In the old days, it was movie stars and women of means, so to speak. But it has come down to more working class people. I guess my point being is some of this driven by vanity? We're poor women and even men. We live in a culture where, we have to stay young or look good, look fit, have no body fat, all that stuff. And it's tough, and it's particularly tough for women. I know that there's a lot of image issues that women go through, and I wish they didn't have to. But do you think some of that motivates it with them not thinking clearly? And like you said, they see an advertisement and it's cheap, and I've always wanted to have that done. Why not? It's a doctor; he'll be fine. Those kind of things get people into trouble, I guess, huh?
I think that plastic surgery is something that many people desire to make themselves appear differently, sometimes better in their opinion, to improve their self-esteem. And you made a point about women being interested. It's not just women. About 10% of all plastic surgical procedures performed in the United States on an annual basis are performed on men. And while, yes, 90% of plastic surgical patients may be female, 10% is not an insignificant number. And men and women are having plastic surgery to enhance their appearance, to improve it. Maybe it's to change something that they had from birth. Maybe it's something that they had due to trauma. Maybe it's something where they wanted to increase their breast size, to take care of a bump on a nose, to help reduce the size of love handles, to help lift jowls or fallen tissue in the face, which has occurred throughout the aging process. For a number of reasons, people want plastic surgery to help them look as young and youthful on the outside as they feel on the inside. And that helps them both at the workplace to remain competitive, as well as in their personal lives to appear attractive to members of the gender of the opposite sex or same sex, to people who they would be interested in attracting.
Now, Doctor, and we are talking to Dr. Adam Schaffner, who is a fellowship-trained Manhattan plastic surgeon. You do a lot of free work for people who need plastic surgery but can't necessarily afford it. Can you tell us a little bit about that?
Absolutely. I'm happy to discuss that, and I'm glad that you brought that up. Yes, I do perform pro bono plastic surgery for victims of domestic violence, for children, as well as for victims of war. And all of the surgery that I perform on a pro bono basis is organized through accredited foundations and organizations that work with these patients, and then those organizations and foundations work with surgeons and hospitals and anesthesiologists to help these patients who are in need.
That's tremendous, really. So a lot of times you're working on veterans and things of that nature, people of that nature, I should say.
That's absolutely correct.
Yeah.
So many of the victims are soldiers who were in Afghanistan or Iraq, who sustained injuries, and our current healthcare system through the military, the Veterans Affairs system, provides an opportunity for those soldiers and former soldiers to be functional, but not necessarily to be the most aesthetically pleasing. And there are things that can sometimes be done to help them, but are expensive and not necessarily covered by our federal government or state government.
That has to be extremely gratifying for you to be able to help somebody in that regard.
It does, absolutely. These men and women are incredibly brave. They have made tremendous sacrifice, and for us to be able to help them restore their dignity and be able to move on with their lives, it's very gratifying.
Do you ever turn anyone away? I mean, who comes into your office and says, I need a little nip and tuck here and some work done over here on the eyes? And do you sometimes say, no, you don't?
I absolutely turn patients away. It's one of the things that I do most often when patients, in my opinion, cannot benefit from a procedure that they may be interested in. So if somebody comes in and says, I want a breast augmentation, but they already have tremendously large breasts, it's sometimes where you're going to say, no, I don't think that this would be appropriate. You may have somebody who has already had, and I've had this situation just last week, a patient who came in 3 months after she had a facelift performed by another plastic surgeon who was very well qualified and did an excellent job, but she thought didn't look tight enough. And in my professional opinion, she looked plenty tight.
Yeah.
And I said, you just need to go ahead and I think take some time to get used to the new appearance of your rejuvenated face. I don't think the answer here is to go back to the operating room and make you tighter.
So, in other words, a physician like yourself has the wherewithal and what's the word I'm looking for? I mean, the honesty. That's not the word, but
integrity.
Integrity. Thank you, doctor. I appreciate that. Do you do anything for aged people who can't remember words? Is there a surgery for that?
I don't think so. Different kind of doctor. So.
Okay. The integrity to say I can't help you. And nor should any other plastic surgeon help you. You're fine. You need to go on with your life and appreciate who you are and how you look.
Yeah, I certainly don't want to speak for all plastic surgeons. I speak for myself, obviously, because there may be another plastic surgeon that differs in their professional opinion, and it doesn't mean that it's necessarily incorrect. It just means it differs from my professional opinion. But yes, there are times when I will go ahead and advise a patient that I think that sometimes less is more and that they are best served to leave their current status alone.
Well, as you said, the word is integrity. Yeah. I mean, you may differ with some other particular professional, but the matter is that you have integrity and you're going to give your honest professional opinion. We talked a little bit about a story that came out of Staten Island, a physician that was practicing there that shouldn't have been practicing, and it's kind of an interesting example of how outrageous this whole issue has become. Can you tell us a little bit about that?
Absolutely. So the doctor was not a plastic surgeon, but was performing plastic surgical procedures and had many lawsuits against him filed over an 8-year period, and the individual is no longer practicing because his medical license was revoked by the state of New York. And it's unfortunate because there were a number of complications that patients sustained, including one patient who lost eyesight in one eye as a result of a procedure that was performed. So unfortunately, there are doctors who are out there who are performing procedures in which they lack the proper training and credentials and expertise, in my opinion, and are winding up causing significant complications. And unfortunately, our state and federal governments are sometimes catching up as they did in this situation over an 8-year period, which in my opinion is a long time to wait before you actually are able to detect and stop somebody from doing these types of things to patients.
That is indeed the headline of that story, that this individual was able to practice for as long as they were able to practice and sort of fly under the radar.
Yes, the press picked up on that, and that was the tagline for many of the stories on which the press reported for that individual.
Well, Dr. Schaffner, we only have about 2 or 3 minutes left, believe it or not. It's been a very interesting conversation. I want to throw the floor to you, perhaps, because I know that this is such a passionate subject for you. What would you like to cover before we say goodbye?
Well, I think that the message that your listeners need to know is that if they are interested in plastic surgery, or if they know of a friend or family member or colleague who is, that you need to tell them to do their homework. It is important to take the time to research the doctor, to check their credentials, to make sure that they are board certified in plastic surgery, to make sure they operate in an accredited facility, that they have hospital privileges for the procedure in which they're interested. I would recommend that you meet with the doctor on at least one, if not 2 occasions minimum before having a surgical procedure. Make sure you feel comfortable with the doctor. Look at before and after photographs of other patients on whom that doctor has operated for the procedure in which that patient's interested. And if possible, to speak with patients on whom that doctor has performed the procedure in which they're interested, so that they can have an understanding from a patient's perspective of what it's like to have that procedure performed by that doctor. And in doing so, I think it maximizes the likelihood of having a successful outcome and minimizes the risks of any complications.
Just fantastic advice. Now, we had talked about it earlier in the program, but you said that you had given out information about a website and also your personal information, not your personal information, your professional information, contact information as well?
Absolutely. Patients can contact me at any time at www.drschaffner, that's DRSCHAFFNER.com, or they can call my office at 212-688-6600, and I'd be more than happy to answer any questions that they have.
And you practice in Manhattan. How many years have you been practicing in Manhattan, Doctor?
I came to Manhattan in 2010 after having been a member of the medical staff at Georgetown University Hospital in Washington, D.C., and was previously in Manhattan up until 2007, at which time I left to go to Michigan. So have had the pleasure of being in the New York area since 1998, but had a little hiatus in Michigan and Washington, D.C.
Were you born and raised here? Or?
Born and raised in Chicago.
Chicago. I would have never picked that up from your accent, or lack of accent.
Well, I'll take that as a compliment. Thank you.
I should just have you say the Cubs, Chicago Cubs.
We can say Dub Bears.
Dub Bear. There you go. Well, my guest today, Dr. Adam Schaffner, who is a fellowship-trained Manhattan plastic surgeon, a nice guy, too, here today because he's passionate about a subject that he has just told us about. Really, do your homework. If you're going to be doing any plastic surgery, make sure you know what you're doing first. Vet that doctor. And Dr. Schaffner, thank you so much for being our guest.
Thank you very much.
WFME Reports is a public affairs presentation produced by your friends here at WFME. Please keep in mind that the content and commentary of our guests are not necessarily the opinions of WFME or Family Stations Incorporated. I'm your host, Jay Trelise. Have a great day.